Hi everyone, hello. Let me just get my comments up and running and we will be good to go. I have no idea what the day is today. Just no idea. Wednesday? Anyway, very excited that we're going to be joined by the lovely Jane today. Hopefully she can join okay. Otherwise I kind of know how to get her on. Oh, that was it. Need to find this. There we go. Who have we got?
Hi everyone.
Oh, let's turn me off. Hi Fiona, how are you? Hi Emma, hi Janice, hi Lamara. Lamara, don't look at my hair today. Right, are you going to be okay there? Emma, I saw tell us more about what you tagged Equiboodle in. What do you want an Equiboodle team doing? Let me know. I couldn't stay on the story for long enough to read up what you were doing or what you were thinking of doing. I'm sorry if I'm a bit glitchy today. We actually had somebody in to come and check the internet and we are performing at our maximum capacity. So we're just going to have to get used to the fact that I'm a little bit glitchy. And I will keep working on a dongle box because yesterday I brought in a dongle box and it doesn't want to work. It doesn't even want to switch on. Hi Janine, woohoo, made it. Missed you all. Gemma, hello darling. What are you all up to today? Hi Mia, how are you, gorgeous? Hi Lucy. So I hope Jane's okay. I sent her the link, but I'm not entirely sure what it's like when you send somebody the link. So she might be frantically, Vic breaks the internet. I mean, just call me Vic Kardashian as I bring down the internet with my 4G dongle. Right, what's Emma got to say? British Eventing are doing team competition at Western Lawns. I think only at BE90. Thought it'd be fun to get a team from here. Oh my God. Well, who would you like to compete with? That is brilliant. Yeah, fabulous. Hi everyone. I lost you yesterday after dropping into a valley. Well, at least you're in a valley. I'm here, but I still don't have any. Here she comes. Here she is. Right. You've all met the very lovely Jane before. Hello, lovely lady.
Hi, sorry, I'm just having to do a rejiggle. It wouldn't work on my phone and then wouldn't work on Safari. So I've just had to download Firefox quickly.
As you do. Well, I mean, we have found this to be the best of the bad bunch for doing these lives. Yeah. And I know that for some of our followers, you and I look a little bit robotic, but I think that's my internet. We just got to crack on. Most people listen to them like a podcast now anyway. So who cares what my face looks like? I don't care. How are you?
I'm good, thank you. Very well.
What have you been up to today?
Oh, I've done a bit of study. And I've been for a sports massage, trying to get those knots out. So that was a bit of unpleasantness, but now it's all good.
Ash is always on at me to go and get a sports massage. I'm like, no way, Jose. No, that is not happening. And massage, yes. Sports massage, no.
It works, but it's painful.
Fiona Gunn is saying, hi, Jane. Ria's saying we look good and we sound fab. We're all go. We're all go. Now, we've actually got a topic today because the last time we met you, gorgeous, you were just telling us about you and we all fell in love with you. But now we're moving on to the hard stuff, aren't we? And today's subject is colic. What a way to get going.
Yeah, definitely. It's one that most horse owners are probably going to be scared of, to be honest, and probably going to meet at some point in their life as well, when they own a horse. So yeah, thought it was a good one to start with.
Honestly, I couldn't agree anymore. It's it's just one of those things, isn't it, that we all dread happening to us. But I think, as you say, a really great discussion point to start off these sorts of topics with you, because I mean, I know for one, I could put my hand up in the air. I probably don't know enough about colic. I mean, what actually is colic?
So it's just a big term, really, that encompasses any kind of abdominal pain. So that could be so anything that's in the abdominal cavity. Usually horses show those kind of painful signs because of gastrointestinal pain, but it can still be any of the other organs, so liver, kidneys, spleen, urogenital tract, reproductive tract. But usually with horses, it's their guts that are causing the issue. And whereas we would just curl up on the sofa, with a tummy ache, their kind of response to it is to try to make themselves as comfortable as they can. So they're still going to lie down, but they'll roll, they'll posture to try and get themselves comfortable. So yeah, colic encompasses a massive number of different possibilities, all the way from like little mild problems to really life-threatening issues. So yeah, it's a big topic to try and cover it in an hour.
Oh yes, I'm sure we can do many follow-ups for this. So basically what you're saying is colic is just like the broad term. There's many different types, are there?
Yeah. So probably the way that we like to sort of look at it or think about it in our heads, we're probably thinking about spasmodic colics. So they're a little perhaps comparable to maybe getting indigestion for us, when you've just had a bit too big a takeaway, that kind of thing. Your guts are cramping, but actually probably just with a bit of pain relief for them and a bit of gentle walking off, they'll probably be absolutely fine. And then your sort of tympanics or gassy colics, when they get big build-ups of gas in their large colon, especially, they're probably the next common thing that we see. And then impactions, so especially in their certain part of their large intestine, where they get really dried out food material, and then the horse's guts decide that at that particular point they've got to do a U-turn, as well as getting really narrow, so everything gets constricted. And then your last, then you can get displacements as well, where parts of the gut have got out of their correct position. And then probably the worst thing that we would see is strangulating or obstructional types of colic, where you've got part of the gut that's become twisted or obstructed by something outside of it that's compromising it. So there are, within each of those sections, there are loads and loads and loads of different causes to each of those as well. So but that's the kind of big sort of main topics that we think about. And then every time we go to a colic, we're trying to do a clinical exam and get the history of the colic, a clinical exam of the horse, so that we can try to work out whether or not that horse has got what we call a medical colic. And that means the pain's going to be controlled with drugs, and sometimes with some fluids, either down into their stomach or into their vein, or whether it's a surgical colic, which means that they might have a type of colic that would mean that part of the gut is becoming diseased or so injured that it actually, without sorting out that problem, either by taking out a section of the gut or putting things back in the right position, that would slowly sort of poison the horse, causing sort of blood poisoning, and eventually causing death of the horse. So we're always trying to, whenever we see a colic, we're always trying to work out, are they medical, are they surgical? And that can those clinical signs and the consequences of the colic can change from exam to exam as well, but in the same horse. So yeah, it's you've got to have your you definitely got to have your eyes on the ball whenever you go to see a colic, and make sure that you're not missing anything early on.
So as an owner, at what point would you say we need to be picking up the phone to call you?
We like to be called as soon as you find your horse colicking, to be honest.
Yeah.
Because then we can have the chat. We can talk to the owner and say, when did you last see them normal? What are they doing at the moment? What have they done over the last few hours? How severely are they colicking? And we can kind of make that judgment call, hopefully, on whether or not we need to blue light it, drop what we're doing and come straight to them, or whether or not we might say, let's just give it 10 or 15 minutes. Let's maybe give only sometimes we'll advise just to give a gentle bit of walking exercise and seeing whether or not those colic signs persist. But usually we will, as soon as an owner calls us, we'd actually prefer to get out on the way, and we're much happier if we get called to a colic. When they arrive, they say, I'm really sorry, he's absolutely fine. he wants to eat again. And they're most likely colic, and we'll still examine them. We still usually go through the full processes of examining them, unless they are absolutely completely normal. And we'll usually give them some buscopan as an antispasmodic as well.
So if you were a first-time horse owner and you just wouldn't have a clue, what would be the early signs potentially of colic?
I think, and there's sometimes the signs that everybody might miss as well. So hanging back from feed, if you're putting feed out in the field, for instance, in the winter, just hanging back from the group a little bit. Bit of dullness, inappetence, little bit of subtle flank watching, so turning to look at their sides. Reduced fecal output as well, so not passing as many droppings as normal, leaving some of their hay net overnight, when they'd normally eat up. So they might be, some of the, and restlessness as well, so just not quite sure where to put themselves in the stable. Or just being really, really quiet if they're that kind of horse. They'll sometimes just put themselves right at the back of the stable and not sort of be engaging like they normally would. And then some of the more obvious but milder signs are going to be pawing at the ground, maybe a bit of lip curling, so that kind of phlegm response that you kind of typically see with stallions, and then getting up, lying down, and then moving on to being a bit more severe signs where they're rolling and thrashing on the floor, and quite often hurting themselves. And I think the difficult thing is that some horses are really, really stoic, or some ponies. Ponies are so stoic, and the native breeds are often so stoic they'll sort of be standing there. Pain. Not rolling, and you put your steps on, and they've got their heart rates through the roof, and you kind of get that feeling that as soon as you do an internal on a pony like that, you're probably going to find something abnormal, compared to maybe a thoroughbred or a warm blood that'll be throwing itself all around the stable with a little bit of spasmodic colic, but they're just that's the way that they are. So unfortunately you can't always use their severity of pain signs as to match the severity of the colic either. So that's where you've got to use your clinical exam, and that's why over the phone we just can't tell.
No. I remember when I was younger, there was a typical Thirlwell-esque pony on a yard, and just as you've described, you would never have known anything was wrong with him because his face was just as determined as it ever was, but he was just repeatedly kicking at his tummy, just repeatedly. That was the only giveaway. But their facial expression and as you say, the stoicism just stayed there, this stodgy little lovely thing. But they knew him so well that they knew that just wasn't normal behaviour. And I guess this is it, isn't it? Understanding what it is in your own horse.
Yeah, and making sure that you that you assess that every day as well, so that you know what's
Yeah.
normal. If you're going away, making sure that whoever looks after them knows kind of what's normal for your horse.
Yeah.
There's really interesting research actually at the moment as well into facial changes, facial expression changes with horses, which we as humans are not very good at picking up on. But actually, when you go from seeing the horse uncomfortable to comfortable again, you know, their eye relaxes, their nostril relaxes. You know, there are some, in those very mild cases, there are some signs that we even will miss as vets as well. Definitely. I think some of the other signs as well, sort of stretching their front legs out and having a stretch almost like a downward dog kind of stretch.
Yeah, I've seen that. Yeah.
That's sometimes trying to go for a wee but not being able to urinate is also can be a sign of urogenital pain, but also of colic pain, because the sort of guts are pressing on everything and they can't go for a wee, but they feel like they need to. So yeah, there's loads of different signs.
So as you've just said, if in doubt, if anything doesn't look right, just please, for the love of God, call your vet. You'd much rather know than not know as soon as possible. But then any advice for what the horse owners can do whilst they're waiting for you?
Yeah, so again, this has changed a little bit over the last few years. We used to sort of, advise that getting them out on the lunge, giving them a bit of gentle exercise whilst they were waiting for us. Certainly, we advise a little bit of gentle hand walking, and that can just distract from the sort of pain and from the anxiety. But we really want our owners to be very, very safe if that's happening. So actually, if the horse is down and just down in sternal, so not on their side, they're not rolling around, they're not sort of traumatizing themselves, we'll just advise that they might be left until we get there, take away any food, actually take away any water at that point as well.
Yeah.
Get there. If it's safe to do so, can you still hear me? We've got the helicopters coming over now that I'm in Salisbury. The army like to. Where was I?
Take the water away.
Thank you. Yeah. So if it's safe to do so, if you can get them into a field or into a manage, or into a school, just actually, because if they choose to go down again, we've got access all the way around the horse, rather than what they love to do is to put themselves down in the stable with their legs towards the middle of the stable, which is really dangerous then for us to be getting in and actually injecting and things if they're still down. So getting them out so they're safe, where if they go down, the horse isn't going to get injured, we're not going to get injured. And they can, if they're colicking severely, they can just go, they'll just drop to the floor with pain.
Yeah.
Doing it out of naughtiness, nastiness. They just need to sit, they need to lie down. So you've got to be really, really careful. Certainly I wouldn't like, unless I've kind of got a history of the horse, really, that I know they're just a spasmodic colicker, and the owner knows them really well, I wouldn't advise any forced lunging or anything like that. So you can certainly, until we've examined them, because you can certainly cause more problems. If, for instance, you've got a huge area of the gut, that's large intestine, that's got loads of gas in it, and you then lunge them, you can. Certainly had a case when I was newly qualified with a horse that couldn't go to surgery. The only option was to try and lunge it in that situation, and that part of the bowel then sadly ruptured. So you've got to judge what you do very, very carefully. The other things, though, really important that you do is make sure you've got some help. Make sure there's somebody else there. Make sure that you know where you are. So that sounds really silly.
No, but this is great advice.
When we're, if you're in if you have quite a large practice, not every one of those vets might have been to you. Not every vet will perhaps know the area that you're in if they work in zones. So make sure
Mm.
the postcode is actually going to get you there. Make sure you've
Mm.
kind of worked out perhaps some directions to give them for anything to look out for. Put a cone outside your field or outside your yard so that they've got something visual to see. Because quite often, especially up where we are, we'll not have, you lose phone reception, so you've got to drive a few miles to go and be able to phone them to get directions again, which can just lose you time and just add to the stress for the owner as well. So make sure you've got somebody there to kind of help you and maybe deal with that kind of logistics side of it whilst you look after your horse. Other things as well is to maybe think about actually hitching your trailer up, organising your transport just in case. Because if we do have a surgical colic, we know that the research shows that any delay in getting to hospital reduces the prognosis. And sometimes that can be, we might have an hour and a half to wait for transport to come. And again, up with us, some of our clients live a long way from the hospital that we refer to.
Yeah.
Not such a case in England. Normally, most of the referral hospitals for colic are well within an hour's reach, so you don't normally have that problem. But yeah, we certainly need to always think about how far they've got to travel as well.
Yeah.
What else do you need to do?
Can I just ask, you said take water away.
Yeah.
Is that because potentially the horse is going to need to be operated on, so the sooner you can take, or is that a completely different reason?
No, we don't. We only, if we were doing an elective surgery, we would only withhold water for a very short amount of time pre-surgery. But the reason is that they sometimes what we call sham drink. So they go and try and get a drink to do anything to try to alleviate it. A bit like when we feel sick, you think, I'll have a drink and see if, oh no, it didn't, it made it even worse.
Yeah.
The other reason is that if they've got a small intestinal obstruction, the fluid can get back up into the stomach, and the stomach, because they can't be sick, the stomach can expand and
got you. Potentially adding. And I love that suggestion about putting out like a landmark for the vet. Maybe people should have like a poster in their tack room or wherever they can, just because when you're panic stricken because your beloved horse is unwell, or any, child, anything, but when something goes wrong, it's almost easier just to follow these guidelines. And what a good idea to have, like, do you as vets, do you ever use that app, These 3 Words, or whatever it's called, where people can give, be a really good thing for everybody to put their location down of their yard as well, wouldn't it? And a cone.
Yeah, anything like that. We have a bit of vet nav that we call as well. You kind of get a bit of a nose for where you're meant to be going. But yeah, is it what 3 words or which 3 words?
Something like that, yeah.
Really, really good. And it gets you, I think, within about a 10 by 10 square. It's absolutely amazing. Yeah. And it means that you can, it works. Then you can join it up to your sat nav, and it'll work perfectly. Because sometimes it is, sometimes really quite hard to find where we're going. And we have those sort of what 3 words. We have it linked in with our clients' details, so we can just see it straight away on the screen if it's a difficult one to find. So yeah, definitely worth doing that.
And then what, as a horse owner, should I prepare myself for any sort of questions that you might ask me at this point?
Yeah, so I think that's another thing to do is whilst you're waiting, is to think, my vet's going to want to know how long has the horse been colicking for? And then there's a little really good question that I like to ask, which is, when did you last see your horse normal? So if you've gone down to your horse at 8 o'clock in the morning, or before that for most people, I'm sure, because you're back at work, then if you last saw them normal actually at 8 o'clock the night before, that's a different story for me, especially if they're really quite uncomfortable, because you don't know how long that's been going on. If the owner says, all morning, he started colicking 20 minutes ago, he's eaten his breakfast, his bed was normal overnight, all of those things, then I'm a much happier vet. So you want to think, when did it last seem normal? How long has he been colicking for? What colicky signs have they been showing? Does the pain come and go, or is it consistent? What's their appetite been like over the last 24 hours? Have they done the normal amount of poos? So perhaps this time of year it's difficult to tell when they're out at grass, but if you kind of have got 5 minutes to go around the paddock and just try and work out whose poos are who, that would be lovely. It's not, I know it's not always possible, but just to, even if you've got an idea of, you know, number of horses, does it look about right? Is not looking. And then have they colicked before? Again, vet in an emergency situation might not have the opportunity to get the clinical history and read through everything. So just have a think about that. And then their worming history. Have they been regularly wormed? Have they been wormed in the last sort of 48 hours? Has anything changed in their management over the last previous couple of days? You know, and that includes, most people think that it's hard feed that will upset their guts, but actually a change in forage, so hay to haylage or moving out onto spring grass, that will also really affect the gastrointestinal system. Yeah, they're the kind of questions we'll ask.
Whilst we're again waiting for you to pitch up at the yard using what 3 words, you know exactly where you're going. I love that. Should we be getting anything ready for you? Are you going to want to be performing any tests on our horses, or are you going to be just?
Yeah, so we'll normally do a clinical exam first off. Again, it just depends on how badly the horse is colicking. If they're really, really sore, we need to get the situation from a safety point of view under control as quickly as we can do. And sometimes we need to immediately sedate the horse without giving any exam at all, just to get the situation under control. Wherever possible, we will try and get a heart rate on that horse before we sedate them, because that's really important clinical information to us. But we will quite often, we'll be getting to the back of our car, we'll be looking at how badly that horse is colicking, and we already know we're going to need to sedate that straight away before we do anything. Important thing when we're doing that actually is that's when I do like to walk them around. I don't want a horse going down after I've sedated it, because they get comfy and they just stay there. So, and then I can't do the rest of my examination. So we'll quite often, we all work in a bit of a different way all over the country, and certainly within a practice. My normal kind of way is that I get a heart rate on them, I have a look at their gum colour, I try to listen to their gut sounds before I'll sedate them. But then every colic for me gets a little bit of sedation, because that gives us that breathing space. We're going to perform an internal exam on them anyway, so we need some sedation for that, actually for safety, but also for relaxation, so that we can actually feel everything. And the owner relaxes then as well. The horse usually calms themselves down, and then the owners will be much more able to take on the information. Whereas if we're still trying to have a clinical conversation when the horse is up and down, we just can't do that. So yeah, we get them sedated, have a look at their gum colour, have a listen to their gut sounds, sort of all quadrants. So that means that we sort of, in our heads, we split their abdomen into 4 quarters. We listen all the way around. We're listening for mixing sounds, and also propulsive sounds as well. So that gives us an idea as to how well the guts are working. And we have a sort of special way of coding that for ourselves, so that if anybody else has to go back to see them later, or if we need to refer them, we've got a kind of standardized way that we communicate between ourselves about that. But me, probably the most important thing though out on the yard in terms of assessing a colic is doing an internal exam, or doing a rectal examination, and that gives us the chance to feel, is there anything abnormal in there? And I think that's probably the worst time as the owner, because we get this kind of look on your face of, you know, we're
Yeah,
having
yeah,
inside, and I'm sure that quite often our facial expression isn't matched with actually what we're feeling. But so what we're trying to do when we're performing a rectal exam, we'll find our landmarks that we know should be there.
yeah,
So trying to orientate ourselves with what is normal, and then we try to find anything that is abnormal. We're assessing, are there parts of the gut that are filled with gas? Are there parts of the gut that are too far forward for even the longest armed vet to reach? Is there a displacement? So is there something that's got into the wrong position? Is there an impaction? Is there nothing in there? Or sorry, no fecal contents in there, you know? All of those kind of things can be really, really valuable. We'll also be able to feel the back of the spleen, up onto the kidneys as well. We can feel small intestine, especially if it gets distended and comes back towards us. We can't feel the liver. We can't feel the stomach. That's too far forward. So it gives us this kind of bit more of the puzzle, but it doesn't give us all of the puzzle. And then we've also got to remember that actually, usually, if we feel something abnormal, we're feeling the consequences of a primary problem. So actually, we might have a twist of a piece of gut, but actually the build-up of gas doesn't happen for a while. Now, we're not going to probably feel that twist. We'd be very lucky if we did, but we will feel the gas. But that can take a little time. So that's why when we kind of think, well, you know, we've got this build-up of gas, for instance, or of fluid within the gut, and then we've got to try and work out which part of the gut that is, and whether or not matching it with the rest of the clinical signs, what do we then do with the horse? So you always want us to say, at the moment, I can't feel anything abnormal.
That's the word we want to hear you say. Once you've got that look on your face.
And it does take a while to do a full rectal exam. I normally take a good 3 or 4 minutes, which is a long time if you're waiting. So I normally kind of talk through, we're trying to assess whether or not this is medical or surgical, and actually the horse relax, my hand just does its job of feeling, and my brain takes it all in. So we hope to find nothing abnormal.
So let's go worst case scenario, and you're not happy, and you think that the horse needs to be referred. What happens then? Calm the owner down, deliver the news, and get going.
Yeah, absolutely. So we're trying to we kind of have a set sort of tick box, if you like,
right.
Those cases that should be alerted as this could be surgical. So a heart rate over 60 beats per minute, no gut sounds or reduced gut sounds, abnormalities on rectal exam, non-response to pain relief as well. So if you've given them a good dose of pain relief and then the colic signs recur, that's when we might need to think about referring. One of the things we didn't speak about already is sometimes, especially if they're very painful or if they've got distended small intestine, we'll pass a stomach tube down as well and see if we get any any stomach contents coming back up. That's again a concerning sign, but it can also be really important in relieving their pain because the stomach distension is reduced. Sometimes we'll leave that stomach tube in for traveling. Sometimes we'll take it out. But if you're getting build-up of fluid back into the stomach, that's a big warning sign. So if we think that those sort of those lots of boxes are ticked, then or significant ones are ticked, then we will we'll get them going to hospital as quickly as we can do. for us at the moment, we don't do colic surgeries, so we need a whole team of nurses that can work 7 days a week, 24/7. Which when you've got quite a small team of vets, the post-operative care, when you're refluxing every 2 hours for a post-op colic, you can't actually do that and still function at the moment, and also give them the quality of care that they need. So we still refer it's our only thing that we refer surgically. We refer those down to the University of Edinburgh usually. But yeah, depending on whether your vets do the colic surgery or if they refer them, they'll make the emergency referral by phone. Let the referring vets know exactly what you found and exactly what they've given, and then get the horse on board and get them going. Yeah, you don't hang about. You don't
no, exactly. And then what would happen when that horse gets to the referred hospital? What goes on then?
So again, this is kind of back in the days when I worked in a referral hospital, or a different referral hospital where we did do colic surgeries. We'll always reassess them, and we'll do those first line clinical exam again. So we'll look at their gum colour. Are they starting to go toxic or endotoxemic? Look at their heart rate, listen to their gut sounds, perform the rectal exam again, because quite often during travelling it can change for the better, but also in certain cases it will change for the worse as well. So you're trying to build up that full picture for yourself. Then the additional things that we'll do at the hospital is to do an ultrasound scan of their abdomen. So we have a technique which is what I think they probably use it in human medicine as well. If Diane's watching, I'm sure she'll tell us. But we use a flash scan technique, which is where we have a set number of points to look at under the abdomen on scan, and we'll get indicators there as to whether or not we've got, say, for instance, distension of small intestine, if we've got lots of belly fluid that's swirling around in the abdomen, if we've got the spleen out of place, for instance, with bowel trapped between the body wall and the spleen. So yeah, we can do, and that's really designed to do a full abdominal scan of a horse takes a long time. Clipping up their full abdomen takes quite a long time. So the flash scan is an idea that allows us to do it very, very quickly. And usually in a surgical case, you've got an answer within sort of 3 or 4 minutes.
Gosh, that's great.
Which is quick. It's not always that black and white though.
Really?
The other thing that we'll use is to do a what's called an abdominocentesis. So we actually pop a little cannula up into the abdominal cavity and collect the fluid that's in there. And that's not fluid that's in the guts. That's fluid that's bathing the guts in the abdomen. It kind of lubricates and allows them to move over each other. And normally in horses that would be a really, really small volume in a healthy horse. But when you've got an inflamed or diseased or dying part of the gut, that is, it's going to produce a lot of fluid very, very quickly. And that's not because it's ruptured. It's just like having a wound, that's going to ooze serum and other inflammatory products. We'll look at the colour of that abdominal fluid. We'll test it for various parameters and see whether or not it kind of sits in a we'll wait and see level, or no, this looks serious. It looks surgical. And there are a couple of other tests that we'll do as well. We'll look at blood lactate. Again, if you've got part of the gut that's diseased or dying, it starts to change the lactate levels in the blood because of the injury that's occurring. So if they're increasing and they're elevated above normal, it'll give us an indication of a horse that might need to go to surgery, but also can give us an indication of a horse that might not survive surgery. You know, a higher the lactate, the more likely it is that we've got to chop parts of the gut out and join them back together. And those horses are generally the ones that have a harder time recovering. Yeah, so it's again, we do all of those tests because we never want to put a horse on the table that doesn't need to.
Yeah.
And whilst in cats and dogs, so doing an exploratory surgery is much less risky. You know, they'll cope with an anaesthetic much better.
Yeah.
They'll have an easier recovery. You know, longer down the line post-operatively, they're easier to control. With horses, they've got a much higher risk of death under anaesthesia, especially when they're sick with colic. You've got the recovery from the actual general anaesthetic in the box, which is risky. Their guts don't like being handled at all. They get really sticky, so you're likely to get adhesions post-operatively. And then you've got a big horse or even big pony that's had their abdomen opened, and that needs to heal. So they've got to stay in a box for at least a couple of months before they're getting out at all. So there's massive considerations before you just put them onto the table.
Yeah.
We wouldn't want to put any horse through colic surgery that we don't think needs to go on there. So those signs, they've all got to be ticked before we want to go to surgery. We do still have the odd horse that will, has had persistent and regular but milder colics that we might suggest doing an exploratory surgery on. But you've got to weigh those things up, and you will have done a full ultrasound scan on them. You'll have gastroscoped them. You'll have done a full workup on those before you'll think about taking them to surgery because of the consequences afterwards.
So again, just asking you as the horse owner, at this point, you really are asking your vets to make the right decision for the horse here, aren't you? It's not a situation that you're necessarily going to go back to the owners, is it, and ask them if they're, or do you still go back and ask them if they're happy to operate?
Yeah, and I think that's actually probably one of the things that I've probably forgotten to say, maybe when you're actually, even before you've called the vet, is actually now, after this.
Yeah.
If you're a horse owner, think, if my horse needed colic surgery, would I go through with it, both from a horse point of view and from a financial point of view? Now, if you're insured, the financial point of view is probably not as important a consideration. If you're not insured, definitely it is, because most colic surgeries you will not get much change out of, probably £4,500-5,000 now. It depends on where you are, which part of the country you are. For us in the north, it's a bit cheaper than that, but I think probably down in England it's more expensive. And then so definitely have a think about whether or not you would go through colic surgery. If you've got a horse that is otherwise healthy, you've not got any other medical concerns, you would, your vets would be guiding you based on what they're finding, whether or not they think, without being in their abdomen at that point, whether or not your horse has a good chance of survival. There are lots and lots of times though when you open the abdomen, and because, like we were saying earlier, you can only feel the consequences of things look worse when you actually can visualize them. Because up until that point of having them open, we've had a rectal exam that you can only feel part of the abdomen, and we've had an ultrasound exam that you can only image part of it in a horse because it's just so big. You don't get a full picture. So you've always got to have that little bit of a sort of caveat in that, actually, when you open it up, things might look worse and they might actually still be inoperable. But we can't say that until we're on the table and we've got them opened up. But we would. It's every case is different. And sometimes you've got to have these conversations on the yard still, you know, when you're
Yeah.
saying,
Yeah.
if it's needed, would you go for colic surgery? If they say no, then that doesn't necessarily always mean that it's you know, that the horse needs to put to sleep immediately. It's, you know, there's lots of cases where you might, you know, you'll get some of those boxes ticked, but actually you can afford some time. You can give them some pain relief. You can maybe give them some fluids in their nose or in their vein. Give them a little bit of gentle exercise. Monitor them very, very carefully for any deterioration of their signs. And we, you know, we might, you know, quite often will, in less severe cases, you'll get them better. What we always want to do is, if surgery is an option, we always need to get them to a surgical facility as soon as we think that might be needed. Because wasting time is the biggest increase in mortality in a colic case. So yeah, we need to get them there quick.
So, I mean, it's just, my mind boggles with just everything that you actually have to juggle whilst you are staring at us from your open boot of your car, and you have all of this information going on in your head and beyond. It's just incredible. We obviously have taken our horse owners through a worst case scenario here, but just so that they understand what the process is, and I think it's been really, really useful for our followers to understand. I'm sure many people might not be that prepared for the vets finding them, the sort of questions they're going to want to be asked. If they were asked how many poos has the horse had and everything, could they know how to answer it? I'm sure everybody could just make at least one subtle change, be it that poster in their tack room or just being a little bit more observant of their horse. And that's what I love about talking to you. Do you, because the time, have you seen the time? We've only got like 10 minutes left. Whilst I wait to see if we get any actual questions coming in on the comments, lovely. Have you got any top tips or anything? Prevention is always better than cure. Can we do anything to help prevent colic?
Yeah, there are some really really simple things that probably most of the owners are already doing, and these are going to prevent or help prevent the preventables. That's the important thing. It's actually, some colics are not preventable, and you must blame yourself for them. But that we can avoid, we can definitely avoid impactions. So they can have regular, keeping their exercise regular, making sure they've got access to plenty of fresh water that they want to drink, especially in the winter, making sure it's not frozen, making sure that if they're on box rest, you know, they get their fibre soaked as well, or they get some chaff and, you know, branny mashes, something nice and sloppy to keep the fluid going in. You monitor that fecal output as well, and actually if it starts to drop, that's the first time that you need to get your feeds going really, really sloppy. So yeah, impactions you can avoid by doing those kind of things. Gassy colics as well, to a certain extent, we can probably avoid turning out onto fresh spring grass, you know, just going out onto a big field or even a small paddock. So probably just trying to introduce a tiny bit of new fresh grass, you know, just by moving your electric fence just a little bit, and just introducing them to that change of forage over a couple of weeks. The same applies to old hay to new hay, or hay to hay. Mix it, do it over a fortnight. It takes at least 2 weeks for the microorganisms in the gut to change their little levels.
No way.
And that's where we think that most the risk factors for change of management is normally about 2 weeks. I don't want people to kind of like lose focus after that, and they can, but that's really important. And actually that's probably where we see most of our gassy colics come from, is when they've had a change of forage, a change of grass, or a change of hay to haylage. And again, though, with that, keeping their exercise regular, you know, so if they're moving their gas along and pumping it all out, then it doesn't build up, and they, you know, their gut motility is kept normal. things like strangulating lipomas, so they're little, what we call little ticking time bombs, so where they've got little fatty lumps that are attached to the sort of connective tissue in the abdomen, and they can loop round parts of the gut and cause obstructions. Now, if you keep them trim, they still might occur, but there's loads of reasons to keep your horses in a healthy body condition rather than fat.
Yeah.
Certainly, the higher their body condition is towards unhealthy or obese, then they are more likely to suffer from those lipoma type lesions. And they are literally, they'll sometimes just be swinging on a little pendulum and just unlucky and lose over. So if you can keep them trim and healthy, you're less likely for that to happen. But they still do sometimes occur even in healthy body conditions. So the other things are just making sure that you keep your routine regular as well, as much as you can do. Try not to change your management in terms of the time length that they're out in the field or that they're in a box too much, or try and do it very gradually again over a couple of weeks. Some horses are really, really sensitive to changes in management. Some horses cope really, really well, and they seem not to care too much. But yeah, I think those are the kind of the main prevention tips. But the important thing as well is they're the preventable ones, and owners always feel, they're always searching for what have I done that's caused my horse to colic, and that's logical because you want to be able to rule out those things and not not let it happen again. But for a lot of the colics that we see, there's actually nothing that the owners could have done. And the other really good bit as well is that probably 85-90% of colics are what we call medical. So
right,
there's a high proportion. The numbers are in our favour that actually the majority of them are not going to need to go to surgery. There's only a small percentage of those horses that do need to go to surgery, but it's helpful from our point of view from the get-go if we know what options might be available to us, because it really does make a difference to how we approach the case as well. And the most difficult thing for us is if you've got you have an owner maybe at the first visit that says no, it's never going to surgery ever, never, and then you need to go back to it. You might have found things that you think, well, this needs to go to hospital, but they've adamantly said no, and then colics, and then 4 or 5 hours later they say I want to go for surgery, and that you might have missed the boat there. So just having, whilst you're not stressed, have a think about what would you do.
Oh my God, and what a good, a slightly morbid discussion, but maybe one to have amongst your yard friends as well, just whilst you're all, fully compos mentis, just a really good frank discussion, so that again, because I know how stressed I could go from like literally 0 to 10 with any of my horses, and and so we all just sometimes just lose our way of thinking because we panic so much when our beloveds become unwell. So maybe just having something just set in place for when if, hopefully never, situations like this occur. Emma's come in with a comment. Now, this girl, it's Emma Berry, we love her so much. She's put, guilty of gassy colic after changing fields. However, Jane, what she doesn't go on to say is she clocked it immediately. She knew probably why it had happened, and she dealt with it, and she didn't do anything for the rest of the day, even though she had really exciting plans going on, and she behaved absolutely impeccably. So she shouldn't make herself look bad, and the horse was absolutely fine. I have to say that because she wouldn't say that herself. So she dealt with it absolutely perfectly. But she does ask an amazing question. So regarding weight, no, it's a nice one, don't worry. Regarding weight, in your opinion, how accurate do you think the weigh tapes are? I love that as a question.
Yeah, so it does depend on the breed.
Right.
So we think for your kind of warm bloods thoroughbred types, they're probably relatively accurate.
Okay.
For your native breeds, probably less so, just because of the bone thickness. We always like to say I've got big bones, but it's true. It's like their pelvises and their long bones, in their limbs are going to be really heavy, as well as their heads are going to be really, really heavy as well. So yeah, probably for your native, they may be slightly less accurate. But there is also, as well as just doing the measurement around the girth, there is also an equation that you can use measuring different points on the horse lengthwise, and then using an equation with the girth measurement to give you a slightly more accurate weight. But I find them, I like them because it's something that an owner can do. I like getting owners to feel physically how they think the horses are, in terms of, do you have to go through a lot of fat to get through to your ribs, or can you see it when they're breathing, see the ribs when they're breathing in. So yeah, I like owners using them, seeing what the trend is, but with the knowledge that they might be a few kilos, sometimes 10, 15 kilos, sometimes a little bit more out from when we would actually put them on the scales. But if you've not got access to scales regularly, having a weigh tape is the next best thing. And doing it regularly as well, doing it every couple of weeks, getting your hands on them every couple of weeks, and writing it down. I like being geeky about those things, because your brain then sees the numbers, it takes it in, and helps you decide whether or not you're going to get them skinny.
With the absolute best will in the world, who on earth could actually keep a constant memory of what the horse weighs and look? So I'm a huge fan of a logbook, basically, for exactly this reason. You could also start to notice just very subtle changes, couldn't you, if it just keeps dipping or going up gradually, which you would just, seeing your horse every day, you wouldn't necessarily notice otherwise. We're going to have to say goodbye. I'm so sad. I could talk to you all day, gorgeous. There was one funny thing. I don't know if you've ever come across this as a vet, but when Emma was telling us all that she thought she had suspected colic, lots of people were advising her to drop the lorry ramp, as in get the horse excited to go and have a poo. I had never heard that, but it seems to work a lot of the time.
Yeah, certainly we would we'd have a lot of horses that we would perform a rectal exam on. They'd have a lot of gassy build up, so tympanic colic, or even a displacement where you've then got a gas build up, and they then travel to the hospital in the lorry and trailer, get juggled about a little bit, and it's improved. It's not necessarily going to solve a surgical problem,
no,
but it might make it better. And so the difficulty is that for us, when you've just got a big gas build up, we can't feel necessarily whether that's displaced, whether or not it's twisted. We're going on other signs. So yeah, there's certainly lots of trainers and owners out there that have quite often put them on the lorry before we even get to see them. They'll have taken. Yeah. We used to get that with race horses a lot. They'd just put them on the lorry, and they'd take them for a 10-minute spin, and if they were still colicking when they got back, then we could get called straight away. But yeah, I wouldn't say I wouldn't do that. I would call us first.
No. This is not to undermine anything that you've just said, but I'd never heard of it. I was amazed at how many times it came up. Well,
good way to get a fecal worm count as well. Apparently, put travel boots on, or put the lorry ramp down. Like, get them go for a poo, so you can get your fecal worm egg counts, which is also really important to make sure you worm regularly to help prevent colic. I forgot that one.
So the same method to get that. We learn that you always come up with a little nugget of something good. No pun intended, but yes, you always come up with something good. Now, just remind us and tell any new followers from this where they can find you, lovely.
Very, very quickly, I think then. So we are, our little podcast is the Podcasting Equine Vets. We are at Look Leaving Equine on Instagram, Look Leaving Equine on Facebook, and www.lookleavingequine.co.uk. Up in Scotland.
Amazing. Now, if anybody has got a subject that they would like Jane to cover, if she can, always feel free to message either one of us. Otherwise, we'll come back to you very soon with another great subject. The comments stay up on Boodlebox now, Jane. So if you want to take time just to have a little look through, I was reading, unfortunately, one of our followers lost a horse to colic a few weeks ago. So I'm really sorry to have seen that. I hope this subject hasn't been too sad for you. Thank you for staying if you did. But thank you to everybody else who has contributed. And this will be going up on IGTV later. I might be able to share it to you if you want me to give it a whirl, if you want to get it up on yours.
That would be lovely, or we can try and post it. I don't know if I can do that.
Yeah, we'll work it out. But thank you so much, darling, as ever. Enjoy the rest of your day. Thank you so much to all the followers, and we'll see you soon. Take care, lovely.